Okay, so your next step in learning how to manage your COPD symptoms is to maximize your medications. So, what I mean by that is you want to get the most out of your medicines. And you do this by discovering what your medications are, how they work, and how to take them. So, basically, the biggest thing that I have found with people is that they do not take their daily breathing medicine. So, this is going to be your inhaled steroids and your long acting bronchodilators. Sometimes people take them and they don't feel like they're helping, so they just stop taking them. Definitely not what you want to do because these medications work on the underlying inflammation. I talk about inflammation all the time with COPD because it is an inflammatory process in your lungs. So these inhaled steroids kind of calm it down and soothe your airways. So they're very, very important that you take them. Also, with that, if you stop taking it, you're not going to notice the problem for about 3 to 4 weeks. And that's the same with once you start taking it, you will not notice an improvement for 3 or 4 weeks. These medications take time to work. So you definitely do not want to be taking them just every now and then, just when you feel like your breathing is worse, because it's not going to help at all unless you take it every day on time. Okay. Now, with the inhaled steroids, you definitely want to rinse your mouth out really good so you don't get thrush. Now, the next way to maximize your medicine is to make sure you're taking it correctly. So, here I have a nebulizer and I'm going to show you how to take it. Okay. So, you want to take the top off right here, and that's where you want to squirt your medicine. I don't recommend opening the entire thing because then you can just get stuff in there that you inhale and you don't really want to do that. So I put the medicine just right in the top there and put this on. Now, this is a reservoir. So I know a lot of people that just take this off and use it like this because they don't like this piece. But I'm going to tell you to maximize your medicine, you want to put this on, okay? And the reason why is because you are going to be inhaling and exhaling through this mouthpiece. So you're going to be breathing it into your lungs. And then when you blow it out, it's going to come in through here. Where this is corrugated, this will actually trap the medicine. So every time you're breathing in, you're breathing it back in. Okay. So you want to make sure that you are breathing in and out through this mouthpiece. Okay. Now, on top of that, you want to breathe regularly, so just normal deep breaths. And then, about every third breath, you're going to take a deep inhale in and hold your breath for 10 seconds. Then you'll blow it out. That's only about every third breath. If you do it too much, you will get lightheaded. So I don't recommend that. But that is how you take your nebulizer. Now, I also have an inhaler here. So it's also super important that you take this correctly. You always want to, when you first get it, you want to, it's called actuating. You want to actuate it so that any kind of dust particles that might be in there from manufacturing is out, okay? Then what you'll do is you're going to blow all of your air out before you take it. So you'll take a nice deep breath in, blow it all out. And once you're empty, you'll take it. Don't put it all the way in, just put it right here, right by your lips, okay? If you put it all the way in, it's going to hit your tongue and the back of your throat. But you breathe it all the way out so your lungs are empty. Put it here. You're going to actuate it. And then you're going to hold your breath for 10 seconds. Once you do that, you blow it out and you do it one more time. Now, I'm not going to actually take this because I don't need it right now, and I don't want it to make me jittery if I don't need it. So I'm not going to do that. But just taking your medications correctly will make a huge difference in managing your COPD symptoms. So that's why I have a whole video just for that, because it is super, super important. And because in my pulmonary rehab, I would always have patients bring their medicine in and show me how they use them. And at least 60-70% of the time, they're using them incorrectly because the doctor does not tell them how to use it and the pharmacist doesn't tell them how to use it. So that's why taking them correctly is very, very, very important.